1 Million Cup Seattle virtually. So you're in the right spot if you're hoping to get to 1 Million Cup Seattle. Okay, there's our link tree. I think everybody that's on the call probably is familiar with that. Get all of our information there. Remember that we're about, in general, supporting each other in the community. Don't forget that even if you're not the presenter, you're part of our community, and if you need help, ask for it. Reach out to people and be willing to support those around you. Remember that this is not a pitch, it's a presentation so that we can provide feedback, and at the same time, we want it to be about the community and to be inclusive. I think that's one of the things I think we do a very good job of here in Seattle, is include everybody. Of course, we have, as we just mentioned, we have communities around the nation. I'm not sure if that 134 communities is right. I think I saw an email that it might be a few less than that, but we'll see how that grows. And so today we're about education, presentations, and connections. We get a lot of positive feedback, and if you have an idea of how we can do better, it doesn't have to be positive feedback. It can be that constructive, helpful feedback on what we can do better here. Remember that we do, as mentioned earlier, we're going to have the one in-person meeting the second Wednesday of each month is what we're trying right now, and we'll see how that works. So if you can't attend, then we're setting it up on Facebook Live to stream so that you can at least see the presentation. Thank you to our sponsors. Remember, this is a volunteer organization with no budget, so we get help from companies like Method Customization and McLaughlin Method to supply infrastructure and items that we need. Also, thanks to our volunteers, a few of who are on the call this morning. If you have an idea, even if it's not, let's say that you're interested in being an organizer, that's great. Or if you have an idea of who might benefit from that, connect us up. Even if you have just a skill to offer or something that you want to contribute at the time. So for today's agenda, we've finished the coffee and conversation. We're going to dive into James's presentation, and then we'll do a 20-minute Q&A, and then we'll have an opportunity at the very end to do some breakout rooms for one-on-one. So as we jump into James's presentation, just remember to limit distractions, concentrate on what he's saying, and figure out, be curious and open-minded, and figure out what you might want to learn more about or what stands out. Remember that we're approaching this from a level of support, and we're not advising or telling James what he should or shouldn't be doing. And with that, when we get to the end, we'll do that Q&A, and of course, use that reaction icon to raise your hand, and I'll call on people one at a time so James can address all of those things. And with that, I will stop sharing. We'll dive into James's presentation. If you want to go ahead and dive in, James, and you can share your screen.
Yep. Can you see my screen?
We can. Perfect. Thank you.
Okay. Well, I always start off with a dog picture, just for the hell of it. Energetix Health is it's a very personal project.
Hey, James.
Yep.
You're on the keynote. I think that we're seeing your desktop, not the actual keynote. Sorry, after I expanded my window, I realized it's not full screen.
Okay. How about that?
There we go. Okay. Thank you.
Okay.
Okay. Sorry.
So Energetix Health is a very personal project for me. Comes out of some of my own health issues and my partner's. So we'll go into that a bit more. I'm not going to throw a lot of stats at you or anything like that. This is just, hopefully you get to know who I am, who we are, what we're trying to accomplish. This is a mission-based company, and that's an important thing to kind of keep in mind. There's a socioeconomic impact that healthcare has that we all know about, but just want to keep that top of mind as we go through this. So, stating the problem, it's obvious. Our approach to healthcare in the U.S. is pretty poor at this point. It is very much about treating you when you're sick as opposed to when you're healthy. So we're trying to turn that around and make it very much about prevention and lifestyle and behaviors. So we're a healthcare company, but we're sort of not, I guess is the way that I would put it. The only stat I'm going to throw at you here is hopefully a startling one for everybody. 200 million people in the US are currently suffering from at least one chronic disease. That's 60% of the population. When I read that, I was stunned. And it's just getting worse. You can see certainly over the last 20 years, the trends are moving that way. And all of our data that we gather comes from the CDC and other sources like that. What we call this is integrated care. And just a little bit of background on me. I ran a branding and design firm for 20 plus years. This is my third tech startup, and recently graduated from the Founder Institute. Heidi, my partner, is currently in that program also. What that's led to is sort of the origin story of the company and really drilling down into why we're doing this. And again, it's very personal. I had a pretty extreme issue, not super extreme, but enough to mention here. I needed a liver transplant 4 years ago. And I basically designed the company around the fact that there has to be a better way, because I was running around to doctors and trying to figure out how to solve it without getting a transplant, and couldn't come up with any real answers. Heidi has a thyroid issue. Same thing. It was just not detected by traditional medicine. So we developed our own ways to get to the heart of the matter. So what we call integrated care, there are 3 building blocks. You got to think of this like a car. Your body is like a car. All the systems have to work together. And mind, body, and self, we hear about that a lot. But the behavioral aspects of this are a place where we've really differentiated ourselves, I think, in that we have a psychologist as one of our medical advisors, and the stresses of life, there's no other way to put it, but those stresses have a lot to do with your health. So we're trying to look at it behaviorally as the start, and then it gets to, what do you think and how do you treat your body, basically. The micro building blocks of integrated care we've nailed it down to these 6 items. I won't read through them, but 2 that I do want to point out. Number 1, symptoms, looking in advance. We're trying to be predictive as opposed to, come on in, you're diabetic and here's a shot, good luck. And what we do is very personalized. When I hear about acceptable ranges in the medical profession, it just makes my skin crawl, because there's no such thing as an acceptable range that applies to everybody on this call. We're all different, and the machines all work differently, and that personalization is a key part of it. So we've come up with a 5-step sort of process that items number 2 and 3 are really the heart of the company. It's the lab testing and the analysis. And we do a lab blood test, which we have developed. It's not the common one that you get at your doctor's office or a hospital. It's custom tuned to the things that we're interested in. And the analysis is really the magic. These are US trained, licensed in-house health professionals. We're not alternative medicine. We're not telehealth. We're not device-based, any of that. It's about personal connections, and the analysis comes out of that personal connection. So just as an example, hormones, okay, very familiar topic. Traditional medicine doesn't measure any of this stuff. And we've got 15 tests that we run as part of our protocol. And the reason is that hormone balance it affects your pituitary gland, and it just, if you go top to bottom on your body, it has something to do with everything. So why they're not testing for this, I don't know. You can go in and say, I want a hormone panel, but you're not going to be given it as a standard. And people think of hormones as a female issue, but for men, it affects muscle mass, strength, libido, obviously, and a number of other things. So it's a universal issue. So all the tests in the world get you only so far. The analysis is really where it comes down to. You need to know how to put the pieces together. So, for example, how does protein affect your blood level, your blood red cell count level, and how does that affect your pituitary gland? And it's like a car, it's a system, and everything needs to be talking to each other. I just happen to know, because of my condition, that the liver is involved in 500 critical bodily functions as a control center for many, many things that we wouldn't normally think of. But that analysis of what goes in, the analysis that comes out of the blood test, I should say, is really the key. Additional services that we provide as part of the program, and this is an all-in-one cost. We give you a personal clinician and a health coach. And this is not just sending you a text, did you remember to do this kind of thing. It's your direct connection to the medical staff and daily or weekly, or however you want to use it, input on what's working, what's not working, adjustments, that sort of thing. And then nutrition, I always say nutrition is where this all starts. In the US, our diet is terrible. And if you wiped out sugar, sodium, and caffeine, or not wiped it out, but seriously reduced those 3 elements, you would feel amazingly better in a very short period of time. So a nutritionist is part of our package. Our primary market is to work within larger healthcare organizations. There's a number of reasons for that, but the main thing is that they've got facilities, they've got patient base, that sort of thing. And what we're providing is additive to what they currently do. It's not to replace anything. Kaiser, being West Coasters, we all are familiar, I'm sure, with the Thrive program. They call that integrated care, but I could go into why that's more of a marketing play than anything, but Kaiser would be a great target for us. We've done extensive market studies. 35 to 65 years old is our key demographic. And the competitive landscape, traditional healthcare is who we're up against, but there are also concierge services and many services that are out there that deal with a single condition. Like you can say, okay, you know, obesity, and we deal with that and that sort of thing. But we're looking at the integrated package of your whole body. What makes us different? Personalized care, the proprietary testing, and the unique analysis, which I've covered. And our go-to-market strategy right now, we're focused on this early adopters program, as we call it, and we're going to run 50 people through the entire sequence to measure the results and also to survey them about the client experience. And we've got our first 2 participants signed up and in the process right now. And then that'll lead hopefully to some pilot programs and more. So in closing, just think about what a progressive healthcare system would look like. And these are kind of the bullet points that I think about. You know, when we started the company, it was a matter of, what do I want healthcare to look like? And these are qualities that I think we could hopefully all agree on. So that's it. We are well poised in the marketplace. The timing couldn't be better. U.S. healthcare is in crisis, and we think that we're the people to solve it. So with that, I welcome your questions, comments, and any input.
All right, let's hear it for James. Thank you for the presentation. And all right, so we'll go ahead and James, we'll switch to Q&A. It looks like we're going to start off with Dale. If you want to jump in.
Hi, James. Thanks for the presentation. That was fantastic. One of the things I was curious about your thoughts on as I was listening to you talk was, while I agree that the personalization is obviously a big differentiator, I was just curious about your approach to be able to scale that, because that also seems very challenging to scale.
Yeah, it's we get that question often, and the bottom line fact is, if you're going for a humanistic approach, you need people. And when you go from 50 people to 500, you need that many people who can adequately cover it. So our clinician numbers will be very large, and I'm really focused on one medical director who's sort of the big picture visionary around all this. But then there'll be a series of assistant directors who would be more in the day-to-day. So it's not easy to scale, is the answer to your question.
Sure.
But we're prepared to do it. And our numbers as we run them takes that into account.
Okay.
We're 9 people right now, and 9 of us ain't going to get it done.
Yeah.
Put it that way.
Yeah.
Thank you.
Okay. Matthew.
Yeah, you just mentioned running the numbers, and so my curiosity is on the financial side of the business, and I think a couple of questions come to mind. One, first of all, sort of where are you? I mean, you mentioned a B2B client, right? You are targeting these sort of bigger corporations, healthcare corporations, and so I'm curious, like, how many clients are you handling right now, if at all? Do you have a B2B and a B2C sort of business model? Because you also mentioned a little bit of the individual consumer, and then ultimately, how are you pricing this and or raising funds as you build this infrastructure out?
Yeah, that's a complicated question, but I do have an answer. So there are 3 scenarios that I can see. If we land a pilot program and we're suddenly dealing with 12.5 million Kaiser members, That's one set of numbers, and the cost to the healthcare system for our services is $179 per month per user. We ran that on Sunday, and that's probably a little bit too low. It's probably going to go to $199, but it's a line item on your in their internal calculations about your premiums. So you never see, Thrive and then Energetix as on your bill. It's like the premium is this, and here are the services that we give you. We're starting off, which is where the company started off, as a B2C model to do this early adopters program to prove the traction. If we don't get any bites on the pilot program, we're prepared to go in a B2C model. The downside there is that if I want to reach 12.5 million people with Kaiser, I got one stop to make. If it's B2C, I got 12.5 million stops to make. And education is a big challenge with this. And then there's a blending, which I see is probably where we're going to end up. We might not get a Kaiser, but we could get like a Banner Health, who's a Colorado, pretty progressive healthcare system. They don't have any program like this. I could see them wanting to do it. They've got 4.5 million members. So maybe we do a deal with them to say, okay, you're going to offer this to your 4.5, and then we're going to continue with our B2C plans as, working together. At the end of the day, the product is exactly the same. It's just a matter of how you deliver it.
Okay. Yeah. Dale, you had a follow-up question there.
Okay, yeah, especially because of what you were just saying about, for example, going through Kaiser, and everything you said makes sense to me in terms of your approach. One thing, and this is sort of a comment, but one thing I thought you might consider is some of the bigger corporations often have health programs that are specifically designed to complement their more mainstream healthcare element. And as I listen to you talk, your program sounds like it might fit that as well. I'm thinking, for example, at Microsoft, they had this partnership with some of their higher end fitness clubs that they allowed, or that they would help compensate employees for, and they would pay for programs that were associated with changing diet behavior, for example, and things like that. That wouldn't be as big as the 12 million you might access through something like Kaiser, but it would be an intermediary as opposed to going straight to the consumer. So I just wanted to share that thought, but you may have already thought of that. So.
That's a good one. And the reason that I'm kind of laughing about this is when we started the company, it was going to be strictly B2C because I didn't want to deal with corporations.
Okay, fair.
Yeah. I'm Mr. Anti-corporate. I'm the only capitalist hippie that you'll probably ever meet. But but then I saw the benefits of the B2B model. However, I always said on our roadmap should be an employee benefit component. And I was laughed out of the room. And that comment that you just made, or some flavor of it, is one that I hear regularly. So it's on my radar for sure. And I'm keeping a very close eye on Calm and what they're doing, because they've gone exactly that route. They have a business employee benefit product, and to hook up with the benefit administrator companies, it's becoming more like a menu. You've got this allowance and healthcare, and check the boxes that you want. We want to be one of those boxes.
Nice.
Okay, thank you. And Matthew, you have another question?
Yeah, totally. So when you think about your sales process on the B2B side, and you think about some of the objections or hurdles that you face in closing those deals, what would you say maybe your number one obstacle will be, and what is your plan to overcome that obstacle?
I love that question, and I've never been asked it before. So, but you're not going to stump me. My pitch to a B2B arrangement would be, ultimately the healthcare system is going to administer this the way that they want to. They're going to market the way that they want to. They're going to price it the way that they want to, all that sort of thing. So as far as the obstacles that they're going to have to overcome, it's the same as the obstacles that we have to overcome. And number one is education. People think that this, I always say this is not alternative medicine. It's not naturopaths. And there's nothing wrong with that route if it works for you. But what we're proposing is very different. It's science-based. So the education component is starting off with, people have been practicing this since the 1930s. And I had the pleasure of, before he passed away, meeting one of the guys who basically in the 30s invented this approach. And I didn't get to spend as much time with him as I'd like to, but that educational component is going to be a big roadblock across the board. But it's another reason that the B2B thing makes a lot of sense, because they can educate people with one landing page or one sub website like they do with Thrive. Thrive was, as I said earlier, it's more of a marketing play as far as I'm concerned, but that whole concept of integrated care as they define it, and we offer this and nobody else has it, that didn't exist. So we're going to have to go through the same process, whether it's a B2B, B2C, whatever. And the simplest answer I can give you is the direct approach to education is, and I've got, we had a whole learning component built into this at one point, and it got to be kind of its own company, basically. But I could see bringing that back.
I have a, does that answer your question, Matthew? You're good?
Yeah, it does.
Okay,
It
okay.
definitely does. I mean, I assumed it would be education, but I wanted to verify
Okay.
that.
I had a question around kind of messaging and the marketing aspect. You had said early in your presentation that you brought up like you're a healthcare company, but not really, kind of thing. And then you said that you're about integrated health. So I guess my first question is there some term or category that better fits what your company does as far as how you would define it?
Well, integrated care, and surprisingly, that trademark was available and I scooped it up. I don't know why somebody would have let that go, but they did.
Okay.
They had applied and it wasn't active, so I took it. Integrated care is the most succinct way that I can come up with so far to communicate what we're doing. And defining what integration means versus what a Kaiser calls integration, or Banner Health or Denver Health or any of these other systems, that's a key differentiator. And from a marketing standpoint, we're going to have to do a very good job of explaining why it's different.
Yeah.
When Kaiser says integrated care, they mean you go to your primary physician and they say, you got a weight problem. Okay, weight loss clinic is down there. Schedule an appointment with them, and good luck. I hope that works out. Okay, it's integrated in that it's all under one name or one roof or in your premium or whatever, but it's not an integrated look at how your body works. And that's the difference.
Yeah, I had also the other thing on kind of the marketing and messaging front is, and I have received this feedback for myself on some stuff that I was putting together. So you're really pushing the personal connection aspect and kind of humanizing, I think, the process around that. And I'm curious on your the slides that you show and whatever material you put out for like your website and stuff. The people that you're showing, are those actually the healthcare technicians or advisors, or those are like the real people that work for your company, or are those kind of placeholders at this point?
No, and I have a slide with our team that I dropped out of this presentation, but basically, in addition to the founding team, myself and Heidi, we've got 3 medical advisors. One of them is DO, which is sort of the highest level of training in this area. It's a doctor of osteopathy, and they're all MDs, and you can't get a DO without being an MD. So that's important. We also have a director of research who happens to be a behavioral psychologist also. And we have 2 writers, one of them heavy science researcher and writer, and then our technical team as far as integrate or how to deliver the product is pretty fully thought out at this point. So on my what kind of help do we need? My 2 biggest holes right now are coming up with, for lack of a better term, a marketing director who's going to take all this and get it out in the world. So that's a challenge that we're missing. And I do want that umbrella medical director who I always joke and I say, I'm going to get you on Oprah, but that's kind of what, if she still had a show, that would be more valid.
I want to be on Oprah.
Right. Well, and I'm a big CNN guy, and Sanjay Gupta, I listen to every word that guy says. And if I could get him, that's who I'm really looking for. Someone who can be the personality that we put on this.
Yeah.
Who's incredibly knowledgeable and experienced.
Matthew, you had one.
I don't know if I answered your question.
Yeah. Yeah, I think so. I just I've got a lot of feedback about, like showing actual people doing actual things, and they're not stiff and posed, and like that type of thing. But Matthew, you had something to follow up with?
Yeah, do we have time for another question?
Yeah, we got time for one more question. Throw it in there.
Yeah, cool. So when you mentioned the sort of competitive landscape, if you will, or the alternative landscape, and one of the items that was on there was the concierge service, and yet in your example of the ideal B2B space, you talked about Kaiser. And so I'm just thinking about the landscape for a moment, and was curious at one point about what your relationship was, what your relationship looked like with the primary care physician. But specifically, I got curious about like, what is your strategy for addressing or being with the concierge service? And I ask in point because, for example, I had the benefit of being a client of One Medical for a long time, loved their approach. And it was very different from my experience with my Kaiser primary care physician in a previous employment situation. And the difference was my primary care physician at One Medical gave me so much more time, attention, and effort in helping me to select and choose and find things. And I could imagine that if my primary care physician in that environment knew about you, they would have given me an immediate referral or recommendation. And it just seems like, I'm curious, like, as you navigate this market, how you relate to the concierge service space, and whether or not it's a market or an alternative, or just curious about that.
We've got a benefit of riches here, because there are so many things that could be improved throughout the healthcare landscape. So to directly answer your question, I want to figure out a way to be of benefit to everybody, be it a healthcare system, a concierge, whatever, a naturopath. You know, they could be sending people to us because we have skills that they don't have. And we're also able to prescribe, and they're not able to prescribe unless they're an MD, you know, although prescriptions are absolutely our last course of treatment. So I want to be able to play with everybody. At first, when we started the company, I said, we need to stay away from private physicians because they're going to get in the way with their opinions, and, you know, I don't agree with this and that sort of thing. And that's just what doctors do. And if we get in that situation, it'll have to be dealt with. I don't want anybody going around bashing what we're doing, just like I don't bash what they're doing. It's just a different approach. And for some people, a complementary approach is a good way to go. For other people, it's good to go all in on one. I'm personally all in on one, and it's worked. So I got nothing to complain about. As a matter of fact, I'm kind of teaching my primary care physician about functional medicine because she doesn't know anything about this. And I say, well, I'm taking DHEA, and she, you know, looks up what's DHEA, you know. So we need to be as flexible as possible, certainly at this stage, and deal with the relationships as they come.
That sounds good. And James, I just want to circle back to something, because you had said earlier, that usually we kind of ask this at the end, but I think you slipped that in already, that right now, the marketing aspect of your company is probably what you need the most help with. Am I correct in that?
Yeah, and
Okay.
the medical director, let me see if I can get that slide back up here. You know, we're a year old at this point, and, you know, I could list 100 things
Many
that we
things.
need.
Yeah.
But let's see, you're
But
probably
at the
not.
top of your list is probably the marketing and then medical director type of thing.
Yeah,
Okay.
and definitely the medical director, because we have patients in our early adopters program, and we've got people who have been asking to be in that early adopters program.
Okay.
Are you able to see my screen now?
Yeah, it's a little bit small. It's not, but oh yeah, there we go. Yeah, we can
Okay.
see it. And then, okay, great. So
Yeah,
those are things that we could help you with.
Yeah, exactly. And, you know, business development is something I'm very comfortable doing, but there's only one of me. So I'm looking for somebody to
Yeah.
really run with that. But they got to drink the Kool-Aid big time.
Yeah, I understand.
The medical director, as I said, we've got people in the system, and a line of people who want to get in. So that's
Okay.
critical. And then the other stuff are, you know, the early adopter program. We need people to sign up for that, but, you know, getting to 50 is not going to be a hard thing. overall, what we're just looking for is support.
Yeah.
That's the easiest way to put it.
Okay, well, that sounds good. Thanks, James. Appreciate you going through that. And you should be able to stop. Okay, great. Usually we wrap up with a few slides, but I got a room full of veterans here, so you guys all know about 1 million cups and that you can present as well. Just keep that in mind. If you want to present, just like James just did, let us know. We'll jump into that. So right now, we're going to go into breakout rooms. And Tiara, are you with me? Or do you have those set up?
I didn't set them up since it's such a small group. Do you guys want to just stay here, or we can do 2 really small groups?
Yeah, I mean, we could do a maybe a couple of breakout rooms. That would probably be
Us versus
appropriate.
them.
It sounds like 2 small groups is what you're suggesting, Dan.
Yeah, that's what I was thinking, but you know,
Okay, got
we
it.
could try that. Sometimes it's fun to have a little bit smaller group as far as to jump into people, but
Oh, I will set those up then.
okay, that sounds good. So Tiara's going to jump you or going to break us into a couple of groups, small groups to talk. And I do appreciate everybody jumping in this morning, and a lot of good questions, even though we had a smaller attendance today. It's great. I appreciate all of that.
And thanks to everybody for your input. These were all fantastic questions. So, you know.
Yeah, I've been thinking about it.
And the organization, I got to tell you, the organization, the way you guys handle your community there is top notch. So thank
Great.
you for everything you've done also.
Okay. Well, that sounds good. We'll follow up with you if we think of some connections that you mentioned there.
Great.
All right, so you guys should be able to jump in.